So, gallstones are basically stones formed within a gallbladder. The gallbladder is an elastic bag which is attached to the liver. It mainly receives bile juice from the bile ducts. It concentrates bile juice and then it leaves into the intestine, which is required for digestion of the food. So, basically the stones are formed within this gallbladder. So, gallstones basically it is more common in people who are obese, and compared to males, females have got higher chances of getting gallstones, or people who have got infections like typhoid can get gallstones, and sedentary lifestyle, or a patient who do not take food in a proper timings, who fast for a long time. All these things are risk factors which will cause gallstones, and it is not genetic or it is not related to any particular reason why somebody should get a gallstone, except for some conditions like hemolytic anemias, where in young people or in children there will be destruction of the red blood cells, which would cause gallstones. So, most commonly these gallstones are detected when patients get pain abdomen. So, this pain abdomen mainly presents in the upper part of the abdomen, maybe in the mid part of their upper part of abdomen, or it might be localized to the right side of their abdomen, sometimes radiating to the back of the abdomen. This, if the patient has pain, it presents like that. Otherwise, some patients will have a vague discomfort in their upper abdomen, some patients will have a bloating sensation after taking meals. These are the ways with which the gallstones can present. Yeah, when patient gets a pain abdomen in the upper part of abdomen, it may be due to a gastritis, or it may be due to other conditions, or kidney stones or gallstones. So, to recognize this, basic test what we done commonly is the ultrasound of abdomen. So, with that we can detect the gallstones and sometimes kidney stones. The diagnosis can be done with ultrasound of abdomen. Suppose if the patient when they go for routine health checkup and they do an ultrasound scan and they found to have gallstones, if the patient is totally asymptomatic, that is if they do not have any pain abdomen or any symptoms, that does not need an immediate surgical treatment. You can observe the patient. Not all the patients with gallstone require surgical treatment. If they are totally asymptomatic, we can observe such patients. So, the current treatment for the symptomatic gallstones is laparoscopic cholecystectomy. So, usually there is no medical line of management if the patients are symptomatic and if there are gallstones. Usually some people they ask whether we can blast the stones and remove the stone, or is there any medicine which can melt the stone. So, usually such treatment are very unsuccessful, and this medical line of treatment and lithotripsy, that is that blasting the stone and trying to remove, is not effective in the gallstones. So, gallstones which are symptomatic mainly needs to be treated surgically. That most commonly done surgery or evident is laparoscopic cholecystectomy, that is laparoscopically we remove the complete gallbladder. Okay. Once these gallstones are diagnosed and if the patient are getting pain symptoms, so the disease can progress. So, usually there is no medical line of management to completely cure the disease. So, as the time goes on, these gallstones tend to cause many complications. One thing is it can cause repeated infection of the gallbladder, and the patient gets repeated pain, and especially if the patients are diabetic or immunocompromised, such patients can land up in severe cholecystitis, and it leads on to a serious condition, and even it can be life threatening also. And secondly, if these gallstones sometimes they tend to slip into the bile ducts, and it might obstruct the bile duct, that will cause jaundice to the patient and then severe pain and infection of the gallbladder and the bile duct, and the patient can have again fever and life-threatening conditions. And third thing is sometimes patients can get a pancreatitis, that is called biliary pancreatitis, and that pancreatitis can be very severe and it can be life-threatening also. So all these patients, if untreated, they may land up in a serious medical situation. So in an early state, when the patient have got symptomatic gallstones, we advise them to undergo laparoscopic removal of the gallbladder. Yeah, it's a good question. Like not all the people with gallstones can get cancer. 1 in 100, if it is left untreated or it's a very long duration. So 1% chances that the gallstones can cause cancer. But the chances that all the patients will get cancer is not true. But it's a minor risk factor where the patient can also have a risk of getting cancer if it is untreated for a very long duration. So usually it's a common doubt or a question which arises. The patient will ask whether our food habits we need to change, or can we have our normal diet after this surgery. Yeah, it's true. Nothing is going to change. Even after removal of the gallbladder, the patient can have his routine diet, patient can have his normal lifestyle, patient can eat whatever he was eating earlier. There is no change in the digestive system, and the patient can have his routine food and diet practices. Yeah, these gallstones are not very common in children. Still, even children can get, and specifically if some children who got congenital hemolytic disorders, then which will kill their own red blood cells, those patients can get gallstones commonly. Otherwise, in a general public, the incidence of gallstones in children is very less. Yeah, as I told you, the risk factors for getting gallstone is obesity, sedentary lifestyle, and unhealthy food habits. So, patient who is having a sedentary lifestyle and taking lot of junk food, oily food, and the patient who are obese tend to get gallstones early. So, by having an healthy food, having lot of vegetables and fruits in our diet, inculcating such diet, and then drinking plenty of water, these things will help in preventing development of gallstones. So, we think once the patient has a gallstone which is symptomatic, we should not neglect thinking it's a simple disease, because it can cause so many complications. So, once you have gallstones and if it is causing you pain, better always consult a doctor, especially a laparoscopic surgeon or a surgical gastroenterologist, so that you can take a definitive treatment for your gallstones and not to neglect the disease of gallstones.